We are at the top of the order, so I think we'll get this started now. And I think since I have the floor, I might start just by wishing everybody a wonderful holiday season. I know this is an odd and challenging holiday season, and the topics we're going to talk a little bit about today are on point for that comment. I will look forward, and at the very end, Oakleigh Ryan is going to talk to us about creating some positive moments during this holiday season. So we're making every effort to, I don't know, flip the script a little bit on what is a very difficult time, and trying to be creative to find ways to make it still a wonderful holiday season. So happy holidays to everyone. We have 5 guests today. Nick Zupan is the Rock County Epidemiologist. Michelle Bailey is our Assistant Director of the Rock County Health Department. Eric Thornton is the President of SSM Health St. Mary's Hospital here in Janesville. And Lad Udi is Vice President, Value-Based Care and Population Health with MercyHealth. And in addition to Oakleigh Ryan, who, of course, is the Chair-elect of Forward Janesville and also owner of Witten House Consulting. So we have a big lineup. We have gotten feedback from all of you that you like it that way, so we are listening. We are going to start today, however, with Nick Zupan, the Rock County Epidemiologist. He's going to give us a statistical profile, I believe, and some insight into what Rock County is experiencing right now as it relates to the whole COVID-19 pandemic. So, Nick, the floor is yours.
All right. Thanks, John. And hello, everyone. My name is Nick Zupan, epidemiologist with the Rock County Public Health Department. So I deal mostly in the data of our public health, and been tasked specifically with providing a little bit of a data update on what we've been seeing in Rock County with respect to the COVID-19 pandemic. So I was on one of these calls a couple months ago in October, and just want to share a brief update about the numbers that we're seeing before I pass it over to Michelle. So in Rock County, as of yesterday, we have 10,119 Rock County residents who have tested positive for COVID-19 over the course of the whole pandemic. When I spoke to this group last, we had about 3,500 total people who had tested positive, and that was in mid to early October. So in the last couple months, we've really seen an uptick in the number of people who have tested positive for the virus. We've also seen a lot of people just being tested. We've had new testing sites available in Janesville and at Black Hawk Tech, and these testing sites have vastly improved our ability to identify where the virus is in the community. So nearly 60,000 Rock County residents have tested negative for the virus. We've had a very good, robust testing in the community, thankfully, in the last couple months as well. In terms of the number of people who are testing positive, we take a look at the total number of people who are being tested and what % of those are coming back positive. Over the last few months, we've seen about 30% of people being tested come back positive. And this, unfortunately, is about 3 times higher than the CDC's kind of highest threshold of what we would like to see in a community to indicate limited spread. So the CDC sets out 10% positivity as kind of that upper threshold where, once we start getting above that, we're seeing lots and lots of COVID activity. It isn't all bad, though. I will say that we have had over 8,300 people recover from their illness. Right now, we have between 1,600 and 1,700 people who are currently ill with the virus, but many, many people do recover from their illness, and many people have limited or very mild symptoms when they get sick. We have, unfortunately, seen some increases in the patients needing hospitalization. Since I spoke to this group last, we were seeing anywhere from 25 to 30 patients in the hospital on any given day. Most recently, we're seeing 40 to 50 patients in the hospital on a daily basis, and in mid-November, we were seeing as many as 70 to 74 patients in the hospital needing care for COVID-19, and this was obviously a pretty big influx of patients needing care for COVID-19. and presented a wide number of challenges. We're still seeing a high number of patients needing hospitalization, but relatively speaking, we are seeing a pretty nice decrease, and hopefully as the weeks continue and we get into this period of vaccination, we'll continue to see the hospitalization rate decline. Finally, we've seen 99 individuals who live in Rock County pass away from COVID-19. When I spoke to this group last, there had been 36 deaths due to COVID-19, and now we're up to 99. So a majority of the deaths have happened recently in October, November, and the beginning of December. When we see lots of cases come up in the community, we start to see higher numbers of patients needing hospitalization. Unfortunately, we will also see higher numbers of deaths, and that's happening in Rock County as well as across the state of Wisconsin. So just in general, we're seeing high trends in terms of the daily number of new cases, but I think the peak of the COVID activity that was occurring in Rock County happened in mid-November. We are starting to see a downturn in a lot of the numbers in terms of the number of new cases, the number of patients who are needing hospitalization, and the number of deaths. And so I'm hoping that we see those trends continue as we move toward the winter holiday period, and we continue to see Rock County residents be vigilant in preventing the spread of the disease. It's a little too soon to tell right now, but the numbers are looking promising from a data perspective in terms of the effects of the Thanksgiving holiday, and I'm hopeful that we continue to see the trends of decrease as we move forward in the next few weeks here. There is some optimism in the numbers. We are still kind of in the midst of lots of patients and lots of people having COVID-19, but I think I'm hopeful that we're seeing a light at the end of the tunnel, especially with the news of the vaccine. So with that, I will wrap up my portion on the data and turn it over to Michelle.
Okay, hi everyone. My name is Michelle Bailey. I'm the Assistant Director at Rock County Public Health. And thanks, Nick, for that good overview. And I would just echo everybody keep being patient because we want to keep seeing these numbers keep going down. We got to hold out a little longer till more people get vaccinated. And I know it's going to be hard around the holidays, but we have seen a little downturn in the number of hospitalizations the last few weeks, and hopefully that is because of everybody sort of just doing their little extra effort or hunkering down more. We don't want to overflow the hospitals, that's for sure, and we do want to limit deaths as much as possible, but we're just going to have to hang on a little bit longer for the vaccine, the hot topic right now, even at our agency. And of course, with something like this, the initial supply is not going to meet the demand. So then that yields to a prioritization system, which you've probably been hearing about in the news. But right now, we are just even talking about one vaccine, maybe a second one coming around the corner as well. But the first one that our state is really ramping up to receive this month is the Pfizer vaccine. And so far, the prioritization groups have been the long-term care, skilled nursing facility, nursing home residents. And there is a program called the Federal Pharmaceutical Partnership for Long-Term Care that is sort of taking care of that population. The U.S. Department of Health and Human Services, CDC, has partnered with Walgreens and CVS to assure that population is vaccinated. And those facilities, long-term care facilities, also have the option to not go with Walgreens or CVS and go with one of their local pharmacies as well to get both staff and residents vaccinated. And then our next priority group has been the healthcare workers. And even with that, healthcare workers, as they start to receive the vaccine later this month, will even have to prioritize within their own agency who is most at risk for becoming in contact with the COVID virus, who's within close contact of positive patients, who's conducting aerosol generating procedures, things like that. So even the healthcare providers won't have enough to meet their demand initially, but that there will be a increasing supply week by week, and by the end of this, CDC and the state is saying that everybody who wants a vaccine will get a vaccine. But for general public that has low risk factors, the latest estimate I heard for general public without risk factors is probably late spring now, even early summer. But right now what we're waiting the cusp on is the Pfizer vaccine needs to be reviewed by the FDA, their emergency use authorization. They've conducted clinical trials, safety studies. So all of their materials and results will be reviewed by the FDA mid-month here. Actually, yet this week was the last thing I was informed of, like the 10th and 11th of this month. And then within a day or two of that, it gets passed on to the Advisory Committee for Immunization Practices, ACIP, and then they will review it and make some more determinations and recommendations of who should or should not get the vaccine. Like right now, it's being predicted that this will come out just for adults, 18 years of age and older, but not yet for children, and not yet for pregnant or breastfeeding women at this point. That's what we're anticipating. And then after the ACIP reviews the literature and makes their recommendations, then CDC will be giving their final recommendation in an MMWR report that will be published. And around Wisconsin, as we prepare to receive the vaccine, the state is in the process of setting up what they're calling these hubs, because the Pfizer vaccine is the one vaccine that needs the super cold storage, the deep freeze, ultra cold storage. So far the state has set up 8 locations around the state, these hubs that they're calling them, that will receive that Pfizer vaccine. Pfizer vaccine is also being packaged in it's almost $1,000 or 1,000 doses per package. So at these hubs, they will be breaking apart that large shipment into smaller packages. And then from there, the state has also hired transport people then to transport that Pfizer vaccine out to our healthcare systems that have signed up to be a vaccine provider to vaccinate their healthcare workers. Anybody that had signed up to be a vaccine provider by the 25th of November will receive vaccine in this first shipment, but probably not their full order. But our Division of Public Health at the state has made a commitment to those providers who signed up by November 25th to at least get them some vaccine. But again, another reason why healthcare systems will be needing to prioritize within even their own healthcare workers in this phase, what they're calling phase 1A. And then each week, as the state gets more vaccine, they will be continuing to fill the healthcare providers' orders so they can get all of their healthcare system workers vaccinated. And today we were on a call, and I think we're just waiting for guidance. They're still deciding at CDC how we will formally transition from one phase of a priority group to the next phase, how that exactly will happen. But CDC is actually holding back a number of doses for everybody who is vaccinated with the first dose, because these vaccines that are coming out are a 2-dose series. You need them 21 days apart or 28 days apart, depending on the vaccine. So everything the CDC releases, like say to Wisconsin to start, they have also already saved a second dose for all of our healthcare workers that got the first dose, because it's also critical that whatever type of brand of vaccine you are vaccinated with first, you get that same brand of vaccine for dose 2. So they are trying to do that very, methodically in an organized fashion. They're attempting to anyway. So then after those people are vaccinated, and maybe even near the end of it, maybe even before every healthcare workers have received dose 2, they might start going into the next phase of release. They did allude to that there might be some overlap of these phases, but they were anticipating it might take us about 3 months to get all the healthcare workers and our seniors in long-term care facilities vaccinated. Let's see, I'm trying to be mindful of the clock because I want to, John, did you also want us to leave time? I guess I was just assuming for some questions Nick or I could field.
Actually,
this
is
specific.
So on point, Michelle, that I would encourage you to go ahead and provide as much information as you can.
Okay, but we're hitting it at least. Okay, let's see here. Let's see, just looking at my so many meetings where, I was just on one this morning, just a couple hours ago. Let's see. What about that? Oh, if if anybody still wants to be a vaccine provider, they can still enroll to be a vaccine provider. So primary care clinics, any provider can still enroll with the state of Wisconsin. That enrollment process has been ongoing, but the state wanted to give some sort of reward or benefit to the people that enrolled by their initial deadline, just so they could start planning and going forward. But so if you hear of anybody, yes, enrollment is still ongoing in Wisconsin. And then there's, just some logistical things too that will be happening once the FDA approves, the ACIP approves, CDC comes out with their morbidity and mortality weekly report. That's that MMWR I referred to. Then actually anybody that signed up to be a provider is also right now in these next couple weeks needing to complete some training on the vaccine, how to store it, how to handle it. The providers are also having to get the medical order to actually administer the vaccine in place. So it's some of those just logistical things that are having to be done. But on the latest call, I'm still hearing that the first, healthcare workers and residents of long-term care facilities in Wisconsin, they're still predicting they should be getting their vaccines in their arms the last week of the year and or that first week of the new year. That's still that prediction of when people will actually start to receive the real vaccines. And then safety and monitoring is always done for vaccines. We have federally, there's a system called VAERS, VARES, stands for Vaccine Adverse, or VAERS, Vaccine Adverse Event Reporting System. And any type of vaccine that we give in public health or healthcare providers give, if we notice a reaction in a patient, if a patient later calls with any sort of question, we can refer them to this CDC program. And there's a very long interview where they are interviewed about all sorts of questions, the timing of the vaccine, other medications they might be on. So this is still going to be in effect, our normal reporting system. Plus, with enhanced technology and smartphones, this is the first I heard of it was a couple hours ago. It's called V-Safe for Vaccine Safe, a smartphone app that will text message people who have received the vaccine to sort of check in with them, see how they're doing, make sure they're not having any side effects or adverse reactions. And if they did, there would also be telephone follow-up to continue monitoring them. And each person would be given a QR code to use with their smartphone what we were told is they will be sort of handed out a fact sheet, it sounds like, with this QR code on it when they receive the vaccine. So just another element of monitoring the safety of the vaccine for everybody, because I know a lot of people are still very fearful. Truly, everything we have heard and that I've seen in public health, this is still going through all the same checks and balances. It just has truly been fast-tracked. So everybody else has probably put aside other work to just get this vaccine through. So that's what I've continued to hear and what I've seen myself on different webinars with CDC and the state, that all our typical vaccine checks and balances, procedures, and actually I've even heard one CDC specialist say actually the pharmaceutical companies are actually even being more transparent with the feds and CDC and all of us than they normally are. They're actually have been revealing more of their data, and we've seen probably each of the companies put a break or a pause on their production when anything slightly, has even come up. So this, we just really do want to stress that, to our knowledge, there have been no steps skipped, even though I know a lot of people are a little worried when they hear sort of this fast track, warp speed language, that, truly we are not doing anything to our knowledge either to jeopardize anybody's safety. That would just be unethical. That's not how we work. And we would be advocating if we heard anything, not correct and not up to high standards. We in public health, even at local and state public health, we would be advocating that we didn't like something we were hearing. But so I guess just even my 2 cents worth is that, everything we're seeing, that they are going by the standard procedures for evaluating a vaccine. And our State Department of Health actually just had posted a request for services online for applicants to be a vaccine vendor, because they know here in Wisconsin, well, all sorts of states, but for our Wisconsin Division of Public Health, local health departments, most of us are still, we are drowning truly every day in disease investigation, outbreak investigation, phone triage, answering questions by phone and email, complaint calls, contact tracing, all of this stuff. And the strategic plan going forward for the state of Wisconsin for the first quarter of 2021 is still testing, and then disease investigation and contact tracing and outbreak investigation. They said they are not letting up on that. So they acknowledge most local public health departments do not have that capacity to give vaccines at this point. And the state did not have any expectation for local health departments to be giving vaccine in these early stages, just because of that workload, at pandemic levels. What we are still committed to. So the state is hiring and hoping to hire by December 15th a vaccine vendor, that one of their jobs will be coming around to all of our communities to host mass community vaccine clinics. And another role of theirs will also be messaging to the public to tell people information and answer questions about anybody's concerns about the vaccine safety as well. That will be another role of this vaccine vendor. But just so everybody's aware, each health department has a different capacity and demand on their capacities right now. So it really is a whole range. As we've talked as health officers across the state, some health departments might be able to give vaccine right now. Some may never. It just is going to depend on our capacity as we go through this. But maybe by next summer, maybe next fall, we might be at a capacity when our disease investigation is not so high that we would be giving vaccines. But everything we will be communicating on our website as well, but for right now, it's just for these very specific groups. It's not open to general public yet. But once that becomes open to general public, we will be posting on our website where people can go for vaccine.
Oh, thank you, Michelle. There's a lot to unpack there. That was a lot of valuable information, and I greatly appreciate it. Hopefully we'll have a chance to circle back and maybe answer or ask you a couple of questions. But at this point, I do want to get our other panelists into the conversation. I'd like to call on Eric Thornton, the president of SSM Health at St. Mary's Hospital. Give us an update on the response from SSM.
Sounds good, John. Can you hear me okay?
Perfect.
Great. Well, as Nick and Michelle reported, we have seen a steady increase in hospitalized COVID-19 patients over the past couple months as the number of cases have continued to rise in Rock County. In our current situation, we do have beds available, but our patient census is high and ever-changing. Of particular note is census in our intensive care unit, which is where a lot of our COVID-19 patients end up, unfortunately. So we don't have a super large intensive care unit, and so we are watching our census there carefully. But as I said, where we are right now, beds do remain available throughout the hospital. We watch volume carefully this time of year anyway, as fall and winter months are usually busy times for hospitals. Also, COVID-19 patients are generally more complex patients. They require more care and they're hospitalized for a longer period of time. So it is, an additional layer of responsibility on top of the work we normally do this time of year. Another factor that we are monitoring and consider carefully is the availability of staff. As COVID-19 circulates in our community, our staff members who also live in the community may become infected or exposed and unable to work. So in addition to volume and beds available, we also monitor the availability of staff closely. If volume comes to a point of exceeding resources, either in terms of space or staff, which isn't our case currently, we do continue to have surge plans in place to manage. Also, we have the benefit of being part of the larger SSM health system with many facilities throughout our region, and so we do have the flexibility with patient placement and staff placement, as that becomes necessary. In terms of PPE, we talked about PPE a lot in the early days of COVID. Right now, we're in good supply. We continue to monitor that. Our supply chain team works around the clock to source PPE for us, and they do a great job, and right now we're in good shape there. From a vaccine perspective, as Nick and Michelle mentioned, that's the hot topic these days. SSM, and I know this is true for Mercy too, have been closely involved in state and local discussions surrounding vaccine distribution. Michelle made a specific reference to our county plan. Provided that the emergency use authorization from the FDA is completed, as Michelle said, we are expecting our first shipment of the vaccine to be received here at the end of December, and we're very excited about that. The federal government has provided guidance in terms of vaccine priority, and echoing what Michelle said, healthcare workers with the highest risk of exposure will receive the first doses of the vaccine. We know that we're not going to get enough doses to cover that entire group of people, so we're even phasing that group. That's kind of the 1A group that Michelle made a reference to, so that those folks will be vaccinated first that have the highest risk. We received the question of if we're requiring our employees to receive the vaccine. We are not. And we will make it available to our healthcare providers who are interested in receiving it. This may change in the future, but where we are right now, it's not something that we're going to require. On top of vaccinating our staff, and Michelle talked about the timeline for that, we expect that it will start here in December and go for months as more and more vaccine becomes available. We want to get the vaccine to our patients and to the community as soon as possible, and Michelle went through the timeline for that. In the meantime, our message for prevention to the community remains the same. Even though a vaccine is now becoming available, until you're vaccinated, you're not. So we encourage folks to continue to mask in public, wash your hands, socially distance, avoid gatherings, the same things we've been talking about all along. We also recommend that everyone receive a flu shot to prevent the spread of flu this year, because on top of COVID, it would even stress our system more if we had a flu outbreak as well. So we're hopeful that everyone on this call has received their flu shot this year. And that's the end of my notes, John. As Michelle and Nick said, I'll take any questions you may have, or we can wait till the end too, whichever you prefer.
I think we'll get through our presentations first, and then we'll see how much time we have left. Things are moving along swiftly. You guys have all been very careful to watch the clock. Thank you.
Yeah, you're very welcome.
Next, I'd like to invite Lad Udi, the Vice President, Value-Based Care and Population Health at MercyHealth, to provide an update from the MercyHealth system.
Okay, great. Thanks, John. And I would just like to express, for starters, appreciation for hosting this call and getting this information out to the community, but also to Nick and Michelle and Eric for sharing their thoughts. I will largely echo a lot of those things, as we're seeing a very similar situation here at MercyHealth to what Eric is seeing across town at SSM Janesville. We're steadily seeing volume. We did see a peak in mid-November that was pretty stressful there for a little bit. We still have a steady influx of hospitalized COVID patients. We have a steady volume in our ICU, but it is manageable at this point. So I liken this to a pot of boiling water on a stove, where it's at a steady boil, but we're not spilling over the sides, and that's the situation we want to try to avoid. But our testing centers are consistently busy. Our hospital is consistently busy. A couple of things that are coming up, though, where we're concerned is that early on back in March, we more or less, as with most hospitals, told people to stay away for a little while, and we just had to figure things out. We weren't sure how exactly it was spread, how exactly to treat it, what we needed to do to keep our employees safe and keep the community safe. We know a lot more about that now. We don't know everything about the virus yet, but we do know at least how to protect staff and how to protect patients through our procedures, which are obviously evidence-based and come recommended by the CDC. And we have not, the good news here is we have not seen spread among our employees at work from exposures. We do have challenges with staffing because people are exposed outside of work. At home, they have a family member who picks it up, or a kid who picked it up at school and then spread it to the rest of the family, or at least exposed the rest of the family. So we're concerned about people staying away and not getting cancer screenings, for example. Cancer hasn't stopped developing. It doesn't go on pause, and neither does diabetes or CHF or other conditions that people still have care needs for. So we encourage this group of business owners and business leaders to encourage their employees to still reach out for their preventive care and ensure that is continuing, because as you know, most likely if we can catch a case of cancer in the early goings, patients have a much better shot, a much better 5-year survival rate, particularly with things like colon cancer and breast cancer. It doesn't work every time, but it helps a lot if you can catch it early. So that's one of the concerns we've seen, is we've told people to stay away, and they took us seriously, and now we're saying, well, wait, now you can come back. Now we know what to do. So for anyone who's hesitant, we do have quite a bit of virtual care and telemedicine available. That's something that we were able to scale up really quickly back in March. And we encourage virtual first for any kind of respiratory symptoms. Even if it's just a cough or cold or flu, this is a respiratory virus, and so we encourage a telemedicine appointment first, so a provider can screen you and let you know if you need to go be tested or what you may need to do. As far as the vaccine goes, similar to what Eric reported, we are we've submitted our forms. We will be an eligible site, and we're ready to go. What we're not sure about is how many doses we're going to get. Are we going to get 1,000? Or are we going to get 100? We know that it will steadily build over time, but we're ready, but we haven't had official communications as to how much we're going to get. But we'll be following a similar triage process as far as who gets that first, and that'll likely be spelled out to us by the CDC and the ACIP, as mentioned previously on this call. So we're excited about that, assuming everything works out well with the vaccine, that's a tremendous public health success to bring a vaccine to market that quickly, one that's effective. So if there's a silver lining in that, at least that science is moving along quickly. As far as PPE goes, we mostly are okay there too. Testing supplies are okay. Exam gloves is one thing that has been challenging, a little more challenging to secure on the market, and so we're looking at alternatives there, but we do have adequate PPE for our staff. The Thanksgiving effect is a question mark that's out there. If history is any kind of prelude, we may see a spike, depending on how well people complied with, having minimal Thanksgivings at home versus interacting with other households. If we are going to see a spike in volume, we'd probably see it soon, and so we're just watching the numbers to see where that goes. A couple other quick things. Cold storage for the vaccine. That's a challenge. The Pfizer vaccine has to be stored at a negative 70 degrees Celsius and has a pretty short shelf life if you don't have a deep freeze capable of that. And so that's we have to be very deliberate about our planning there and make sure that we don't waste any doses. Lastly, it's interesting to think about this sometimes when you think there's 163,000 or so residents of Rock County, and there's really only a few hundred hospital beds available. And most of the time, that's actually fine because most people don't need a hospital bed most of the time. But the flip side of that is that it doesn't really take that much to get overwhelming and to overrun. So if we see any kind of significant spike of people requiring hospitalization, it could be problematic. And as you know, if you're in a car wreck or something, or you have any other kind of accident, non-COVID related, you want to be sure there's a bed available for you or your loved ones as well. So we're begging, pleading with the community. We know we all have COVID fatigue, but asking everyone to be mindful of that and just hang on a little while longer and wear your mask and social distance and try to do your best to connect with people in other ways until we can reach herd immunity. But herd immunity really doesn't happen without a vaccine. And we'll get there, but it will take some time.
Thank you, Len. We have a lot of questions, and so I would ask Oakleigh to just stand by. I think we'll get into some questions first, and I'll start with Nick. The 99 deaths that we've experienced. Is there a statistical profile of the folks who have perished? We hear stories about elderly people, people who have some sort of compromised immune system. Is there a profile of the people who we've lost?
Yeah, what I can share on the call, and we have some of this information on our website as well, but we're seeing, by and large, the majority of people who are passing away are elderly. So the average age is around 74 years old. And people, generally speaking, have chronic conditions, and those can include things like diabetes, obesity, cardiovascular disease, things like that. But that is not necessarily true of every single person who has died from COVID-19 in Rock County. We are seeing deaths in younger age groups with, among people who don't really have chronic conditions or don't have compromised immune systems. So, it's a tricky situation because we are seeing people who are at higher risk depending on their age and other conditions. But, if you are young and you don't have those risk factors, there is still a risk of becoming severely ill from this illness.
I'm glad you made that point because there is that threat out there that if I'm not old or compromised in some way with my health, I'm fairly safe. And, of course, as you just said, that's not necessarily true. My next question relates to testing capacity. I don't know, perhaps, Michelle, there's rumors that we might lose the Black Hawk Tech testing facility. What's the latest in terms of testing?
Yes, well, we were very pleased to just hear that the feds approved an extension for the Wisconsin National Guard, the wing, to continue testing at least until through the first quarter of 2021. The latest I heard from the Division of Public Health was, though, it might tweak a little bit. Right now they're in the process of having any of these regional test sites that have been going on around the state, they are re-enrolling to continue being a test site if they so choose to. And so Black Hawk has shared with the county that they have some decreased capacity going forward, but want to still help in every way possible and to assure this continues. So they are partnering through Sheena Kohler, our emergency management director, and then the county EOC, and they are actively working on recruiting enough of staff right now to still maintain it. They were in the process of filling out the re-enrollment application to continue being a test site. So I feel very good about it. The state just said that the schedule might change, like maybe for some reason we only get 1 day a week versus the 2 days a week like we are now, or the day may change. But so far it's sounding real good, and we are moving forward together as a community to try to assure continued testing.
That's terrific news. I know a lot of people who were concerned when the news was circulating that testing opportunity may go away. So that's terrific to hear. I have one more testing question, and Oakleigh, I'm going to put you on notice that I'm going to throw it to you for a question after this one. But there's a question about antibody testing, and I'm not the smartest guy in the room when it comes to these different kinds of tests, but the story is that there are people who have been tested positive. They have family members that are around, and these family members, for some reason or another, do not test positive. They don't catch the virus, even though they're around someone on a daily basis who has it. And the theory is that they have the antibodies. And there is evidently a test about whether or not you have the antibodies. Can someone talk to that particular test and how one might get that test?
I can speak to it from a St. Mary's Janesville perspective. You do have to connect with your primary care physician in order to receive an antibody test, but we do provide those here. So if somebody would like an antibody test, they would access that through primary care. In terms of the exact situation that you're referring to, that I can't address. Someone from the health department might be a little better for that. But in terms of the availability of antibody testing, that is something that we provide.
Yes, and that's the same case across town at Mercy as well. We provide those tests. What we don't know right now is, okay, you get an antibody test, and then it shows you have antibodies. Well, what does that actually mean? Does it mean you're immune? Does it mean you're immune for a period of time? Does it mean you're just more resistant to it? So the science is still playing out on that. But, yes, we do have them available, and the first step, as Eric mentioned, would be to consult the primary care provider.
That's a really good point. The science is unsettled on all of this, isn't it? Still trying to figure things out on the fly, it sounds. Oakleigh, I'm going to throw it to you. I think you have a question you'd like to ask. Are you there, Oakleigh? Oh.
John?
Yeah, are you there?
Hi. Yes, I am. This has been just so informative. I forgot that I'm supposed to say something on the call. I've been taking notes. I think this is a question for Michelle. We moved in a recommended phase 1 a few weeks back when we started seeing on the county dashboard some reds popping back up, especially around capacity, and I think Eric and Ladd have spoken to that very well. What do we need to see to get back to move back to phase 2?
Probably continued, decrease in all of those red areas, the fullness of our hospitals.
Right.
We're monitoring not only the patient beds, but their staffing capacity. Even what they're telling us, we meet with representatives from the healthcare systems each week, and based on what they're saying, because sometimes, like our other presenters have said, you might have bed availability, but staff might be short because they're ill or quarantined.
Right.
So probably going to have to see a lot more improvement of that, but it will come, and won't we all be happy when it does? And I think then with the increased vaccination too, that slowly over time, this has been very trying for all of us, but we've just got to hang in there, a few more months here, and we will start seeing things go down and can then continue to reopen more safely. But we just really, none of us would want to be told our hospitals are full and we have to be diverted elsewhere, or there's only room in the hall, or, and I was a nurse myself before in a healthcare system, and it's awful to be so swamped and you can only attend to your patients a couple times a shift, if you're that busy and that short-staffed. So we want quality care. We want, and then if our staff are that run down, they're sick as well. So, but just a slowly improvement on all of those different metrics. And as Nick has often mentioned, it's not always just those numbers you're seeing on our dashboard. It's a lot of these conversations we're having with our healthcare partners, their recommendations, school conversations with school. We have staff that meet with the school systems weekly as well. So it's sort of a combination of, best practice, what's being recommended at the higher levels from CDC, the state, what we're seeing here locally. It's really, we try to look at a lot of different things. It's, when looking at it, not just one metric. You bet.
Michelle, I have another question that came through from a member, and I think it matches up with what a lot of businesses in the area are thinking about. Many businesses, to the extent possible, have sent their folks home, say, let's figure out how to work from home during this interim period. There comes a time, however, when we need to plan for getting people back into an office setting. And the question is, some people are going to refuse to get vaccinated. Is there guidance from your office or from some other place to help businesses understand what they might expect from their employees, what they can and cannot do when the vaccine is available and it's time to bring everybody back to the office?
Excellent question, and I've been thinking that as well. And actually, this Thursday, I am attending a conference by the National Public Health for Law that I believe will probably be addressing some of those issues. What we heard early on from the Division of Public Health, one of the preparedness coordinators at the state, and he was referencing back to H1N1 in 2009. He said, through all the court cases and things that happened back then, to his knowledge, is that as employers, we cannot force or mandate our staff to have a vaccine if they are already staff on board. We can, however, make it as a requirement of employment. So there's a difference there. So new staff that we would hire on, we could require as a condition of your being hired here, we do require that you get the COVID vaccine or something. That's honestly what I've heard. I'm wondering if the healthcare systems, if you've heard other things, but otherwise, right, I'm all ears to that right now, because we know that's going to be a big question for everybody. And like I said, this Thursday I might learn a little more.
Lad or Eric, has this subject come up in your circle?
This is Eric. I can start, and I welcome Lad to jump in as well. So this is not within my kind of my area of expertise. The question is really a legal question more than a health question in terms of what can you require of your employees. But the information that I have read online about this suggests that particularly when we're in this emergency use authorization part, we're not suspecting that we'll see a lot of employers requiring it. But for example, there are employers out there that require a flu shot. So if a flu shot can be required, I'm not sure why this would be different from that. But we're so far from that point right now. But in terms of how far this could go, I would welcome the folks with more of a legal background on the call to chime in. Ladd, I can turn it to you as well.
Yeah, I don't have too much more to add other than I did fail to mention we won't be requiring it of our partners at this point for the same reasons. We are a little uncertain on that ground. However, we do require a flu shot of our employees, so we may get to that point, but we're going to start with what we can. We think that there will be a pretty high demand for it, and as things play out and become a little more clear, then we'll make a decision on the requirement.
Yeah, I know the numbers vary depending on the source of the study or the poll, but last I read, it's between 60 and 65% of people who say they're ready and willing to get the vaccine, which means that 35 to 40% of people are not. And I'm wondering out loud if that 40% constitutes a public health risk even after we have all the vaccine. Is that something that you worry about, Nick, Michelle?
This is Michelle. I would say, yes, that is definitely something we'll be watchful for, and that is part of the reason when I mentioned the State Division of Public Health is hiring that vaccine vendor. One of their duties will be communication and messaging to try to address people's concerns about that. But I think we see that with every vaccine. There's a few that just don't, and yet we can also, if we get the numbers high enough, to achieve herd immunity through people that have been diseased and or the vaccine. But definitely we'll be doing what we can to message as well for people, for persons concerned.
In our office, we would love to be your partner in that messaging and do what we can to get the word out as well. Oakleigh, with 7 or 8 minutes left, I'm going to throw it to you for some comments related to creating some positive moments in this time of COVID.
That sounds great, John. And I want to there's things we can't control. And there are things we can control, and I always try to focus on what I can control. But I do want to say thanks to our folks on the call. My son is just home from college. I use the electronic MyChart to communicate with his healthcare professionals. It's so efficient, it's so effective, and the vaccine has helped move us there faster. But he made the comment, he's been going to his pediatrician, Dr. Gelser, since he was 2, and he said, Mom, do I really have to switch? He's 21 now, so what you all are doing in the healthcare field is truly remarkable, so thank you. I know there's a huge encouragement for masks. It's not a bad thing. I've got a collection of 10, and I now get carded at Woodman's, and I guess they just think I look younger with a mask on, so there you go. We started these calls, John, at the start of the pandemic. They were weekly. We wanted to create a sense of community, but more importantly, an important communication flow. We flexed the frequency, and we're now doing monthly, but we've heard positive things from you, our members. I've appreciated them. Again, my notes were long, and I appreciated the specificity of information. We go deep on these calls. But the question we've asked ourselves is, why haven't we done these kind of calls before? Does it create an emergency to do this? There's good information out there, and they sure are efficient. One of my favorite leaders, Winston Churchill, said, don't let a good crisis go to waste. My flip on that is, it's not what happens to you, but what do you do when things happen? And people are creatures of habits. We don't like change, so that's what a crisis does, is sometimes allows you to change behavior, which brings us up to really our wrap-up topic. Because as we end the year 2020, which will go down in infamy, we want to end on a positive note. So creating positive moments in a time of a challenge. I don't think anyone can argue with that. Just makes sense. I just want to reflect on the last kind of 5 minutes of this call is what really is the power we can create when we do this, but more importantly, it's the execution of it, the how. So the power. I mean, we all know how we feel when someone gives us a compliment. I can't imagine the health department when someone calls and thanks them and doesn't complain in this time. A sense of purpose, making a difference. Healthcare workers feel that a lot. I remember working with my Quint Studer on his first book, Hardwiring Excellence, back in the early 2000s. And when we wrapped up the book, Quint had to choose one quote for his first book, and he chose Ferdinand Foch, French Supreme Commander of Allied Forces in World War I, talking about the human condition. And the quote was, "The most powerful weapon on earth is the human soul on fire," the human soul on fire. The economic benefits are huge. We've been talking about health, the health of the spirit. The human body is the most complex organism probably on this planet. How do we maximize its potential? How do we unleash its potential? Ladd talked about the speed of the vaccine development. Yes, that was science, but it was people driving science. Make it really practical for you all. Just look at the Packers. Oh, my gosh, what a difference a year makes. I'm not hearing about X's and O's when I tune in. I'm hearing about the chemistry of the team, the trust, appreciation. No one argues that it's not, I think, critical to engage emotional component to create that human connection, right? We know the power's there. But the question, and where I spend a lot of my time working with leaders and organizations, is how do you do it authentically and frequently enough for impact, especially in a time of crisis? That's what I want to wrap up with you, some tips today. In prepping for the call, Ladd was kind enough to share some insight from the American Psychology Association on resiliency of humans. There are 4 things to think about as you care for yourself, as you care for your loved ones, and you care for your employees. One is prioritize personal and professional relationships, and that sure is hard in COVID, right? Emphasize self-care. We talked about that. Identify opportunities for self-growth. We're not growing, we're dying. It's that black and white. And maintain a positive and optimistic mindset regarding challenges. These are great tips, but again, where I spend most of my time is it's how do we make the decision that it's good? That's one thing, but how do we do it? And so, being outdoors is a powerful thing. We're the city of parks, great outdoors. I mean, how do you make the decision and commit to reconnecting and walking with a friend? How did my husband finally get me to go on walks at night with him? Something had to happen. People have adopted dogs at impressive amounts, and we don't seem to need people to do that. But, we've got a community that is waiting to help us regenerate. You, your family, your teammates, the light show, Town Square Fire Pit, walking trails, parks, RCHS Tree Show, and for Janesville has even got its own Let It Glow contest. But the question is, are you, your family, your employees, are they making the decision to go and do it and doing it? And that's the science of creating positive moments. And I'm going to leave you with 4 practical tips that I've been talking about in my kind of 2 decades of organizational development and performance excellence. And you have to hardwire them. And what I mean by hardwire, and my healthcare colleagues will recognize these words, is you have to be methodical and intentional about them. And there are 4 things. They're rounding on your employees, the people who report to you. It's about creating a personal connection. And it's different than saying you have an open door in COVID time and a constant Zoom going on. It's about creating that personal connection. And COVID has done something remarkable, and I think it's going to help us in the business community. The lines between work and home are blurred, if not gone. And so asking about one's family, about a sick child at home, about a mother-in-law, it's okay, and do it, and create that personal connection. Gallup Q12, famous employee loyalty test, one of the questions is, I have a best friend at work. So rounding, and folks, it's one-on-one. It's hand-to-hand combat in creating those relationships. But how do you make sure you're doing them consistently? The other thing as I wrap up here, they're simple, common sense things, but sometimes uncommonly practiced. Thank you notes to the home. I just got a thank you note from Classy Rascals, the cute little kids boutique, thanking me for their patronage and offering me a discount. I think the greatest thank you we've seen in the community is the RCHS Art and Art League Heart Art thank you throughout the community. Thank you notes, it's so important. Recognition. I was on a call today with the Janesville Jets. Tough time for the team, but they're practicing. They're playing with no fans. But the coach called out one of our directors and said these words, I know it's not in your job description, but thank you for driving down to O'Hare to pick up the new player. It made all the difference in the world. That's going to have an impact on that employee. Another company I know, instead of doing a holiday party, asked for their employees to vote on top charities to donate to. There's so many amazing things. And I think the last tip that really resonates in creating positive moments is connect to purpose communication. If with a sense of purpose, there's almost anything we can do, and Eric and Ladd will speak to that, and Michelle about healthcare workers. So whether it was Prent talking about the difference face mask production made when they did that, whether it's talking about the ICU nurses decorating the tree outside the Tallman House to kind of showcase the work they're doing, whether it's the Postal Service talking about the workers they're doing now and their huge amount of work. Helping your employees see the difference they're making is huge. So I want to wrap this up that we have an incredible power with human resiliency, but folks, our job as leaders is to take care of ourselves so that we can take care of them to help them unleash what's lying there. I think we're in an interesting time. We're past the election, but we're waiting for the vaccine. Let's not make this a void. I think this can be one of our finest hours in Janesville. We are and will and can experience the power of connectedness and the power of community, but it takes intentional thought, and it starts with you taking care of yourself and then going from there. So I'll end with that, and thank you so much.
That was very powerful. Thank you very much, Oakleigh. And thank you one last time to all of our panelists for joining us. And last but not least, thanks for all the listeners who tuned in today. Again, happy holidays and take care. Thanks again. Bye.